When COVID-19 first struck the U.S. and began spreading, one of the more positive findings indicated children were not greatly affected. Since then, however, that's another element of the virus that's changed. Now, almost 340,000 children have tested positive, with nearly 100,000 of those cases coming in the last 2 weeks of July. Another disturbing development is the potential long-term issues for young and old. Doctors worldwide report increasing numbers of disturbing brain problems stemming from COVID-19 infections.
Lori, this has been a major issue, and in fact, several papers have already appeared documenting the various neurological syndromes that occur with COVID-19.
It's something that happens not when you get the infection with COVID, but a few weeks after you get infection with COVID.
More than half of the patients in a new medical study complained of neurological problems 3 months after recovering from their initial infection. Cognitive issues like difficulty concentrating, extreme fatigue, confusion, headaches, and insomnia. It could be just the tip of the iceberg.
So there's a lot of ongoing speculation about whether there will be post-COVID Alzheimer's or post-COVID Parkinsonism or other phenomena we just don't know yet.
Pat, just another piece of evidence backing up what NHI Director Dr. Francis Collins told me when he called COVID-19 an unprecedented disorder and that treating it is like navigating uncharted waters.
Lori, that's terrifying. People think, okay, I've got the little COVID and I'm going to get over COVID. But we didn't realize the extent of the associated illnesses. What are some of the brain problems? And the doctors believe they could be long-term.
Well, you're right, Pat. It was at first just, we wanted to just survive it. And so it became a thing of just living or dying. But now there are all these other complications. And to answer your questions, we're talking about things like brain fog, loss of taste or smell, depression, muscle weakness, even memory loss. And we're seeing this in COVID patients weeks and months after they thought they had gotten better from the virus. And it remains to be seen if we see these types of things years down the road, but we have seen it before, Pat, in other viruses like the Spanish flu from 1918. We saw in the 1920s and the 1930s people who had this form of encephalitis, which is brain inflammation, which turned into Parkinsonism. And so this is something that we've seen in other viruses and other pathogens as well, like bacterial infections, like from Lyme disease, which comes from tick bites. We've seen that is directly associated with Alzheimer's disease, and also fungi like mold also can cause terrible neurological problems, including Alzheimer's disease.
Well, what other areas of the body besides the brain is being affected?
Well, one of the most concerning things that we've talked about before associated with COVID-19, and this is something scientists know for a fact, is that it causes hypercoagulability, which means that it causes a lot of blood clotting. And we've seen blood clots in the lungs, and perhaps more concerning, strokes, even in young people who have no other symptoms of COVID-19 are having strokes. And they don't know what stroke symptoms are, so they don't get to the hospital soon enough and have permanent damage from strokes. We've also seen lung scarring, heart and liver damage, Pat.
That's enough to terrify everybody. You talk about not wanting to go out and eat at a restaurant or go to a theater. I mean, why would anybody want to congregate if they're going to get something as deadly as this?
That's true. So the good news, and we need to talk about the good news, is we know how COVID-19 is transmitted from person to person and how we can avoid getting it, wearing the mask, staying 6 feet apart from other people, washing your hands as often as possible. And we've been hearing this for 6 or 7 months now, but it's amazing how few people actually do that.
Well, boy, this is reason enough to wear a mask. I mean, it's so easy to do. Lori, if somebody does get COVID, what would the doctors or like Bredesen and others recommending people do to prevent themselves? I had one guy on talking about, he was talking about glutathione.
Yes.
And do you have any recommendations on any of those things?
So many recommendations. First of all, avoid getting it, but there are some things that people can do if you do get it that can really strengthen your immune system and can help prevent from having a lot of these problems and complications. A lot of doctors have their own methods, but one that I talk to, in fact, many doctors say, take that zinc supplement every day, vitamin C and vitamin D every day. That'll really boost your immune system. We've also talked about a healthy gut. And then there are some other things that are kind of controversial. You know, the hydroxychloroquine, the budesonide. Some doctors say those are very good for prevention. But also, Pat, just being a healthy weight. We've seen with these children, a lot of these children who have had problems have had some underlying conditions. And health experts say the number one underlying health condition is obesity, and some of these doctors I've spoken to say the adults who have problems tend to be obese, and then we see other underlying conditions such as type 2 diabetes and heart disease, which are directly linked to being overweight or obese. So this virus might be with us a long time. Now's the time to start watching your weight, and this is something we all need to do.
I watched mine. Mine is down. I weigh less than I did when I was 15 years old, so I think that's a good thing. But Laurie, I appreciate what you're saying, and I'm telling you, ladies and gentlemen, if this doesn't frighten you, I mean, why would anybody want to go out and to a crowded restaurant without a mask with the danger that this could do to your system? It's very frightening.